Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question is, what is the association between creativity and bipolar disorder? Now, to help answer this question about bipolar disorder and creativity, I'll be using an article published in 2015 by Johnson and colleagues, where this question was examined. I'll put the reference to this article in the description to this video. So it's important to start with the concept of bipolar disorder and look at the different types before getting into the comparison with creativity. So with bipolar disorder, we see bipolar I disorder, bipolar II disorder, and we also see a disorder called cyclothymic disorder, which is related to bipolar disorder. So with bipolar I disorder, we see manic episodes and usually depressive episodes, although technically only a manic episode is required for a diagnosis of bipolar I disorder. Now with bipolar II disorder, we see hypomanic episodes, so the mania is not as severe as what we see in bipolar I disorder, and we also see depressive episodes, and the depressive episodes are required for a diagnosis of bipolar II. Now with cyclothymic disorder is similar to bipolar II disorder, except the full criteria for hypomanic episodes and depressive episodes aren't met in terms of quantity, severity, duration, or pervasiveness. So the cycle of symptoms is similar to bipolar II disorder, but it's not as severe. So moving back to bipolar I disorder, I mentioned bipolar I disorder has manic episodes. And manic episodes are periods where we see elevated, expansive, or irritable mood. And there are a few different symptoms associated with manic episodes, like grandiosity, a decreased need for sleep, being talkative, having racing thoughts, being easily distracted, being goal-directed, and acting in a manner that can lead to painful consequences. So with the distinction between the different types of bipolar disorders in mind and an understanding of mania, what do we see in terms of creativity? Well, in the research literature, we see a lot of anecdotal information and some studies with small sample sizes, but there does appear to be an association between fame achieved because of creative endeavors and mild symptoms of bipolar disorder. So some of the symptoms we see with cyclothymic disorder, for example. But we don't really see a strong association between creativity and bipolar I disorder, and that's what this particular study is looking at. But in terms of the association that we do observe, why is this the case? Why is there a link between some bipolar disorder symptoms and creativity? Well, there could be a basis in genetics. It could be the positive affect associated with bipolar disorder. It could be the increased goal-directedness or the disinhibition. But another theory suggests that it could be divergent thinking, that is, having a number of possible responses to one stimulus. The problem here is that there's not a clear link between divergent thinking and bipolar disorder, and there's also not a clear link between divergent thinking and creativity. With creativity, we see uniqueness, and the ideas that are generated have to be functional or valid, and we don't necessarily see that with divergent thinking. So measuring creativity is one of the difficulties in studying a subject matter like this. In this particular study, a number of measures were used to try to capture this construct of creativity, far more than just looking at divergent thinking. And again, with this study, they were specifically looking at bipolar I disorder. So the participants had bipolar I disorder, and another group of participants, the control group, did not have the disorder. So the two groups were measured using multiple measures of creativity, and then we looked at the results. And what we see here when specifically comparing bipolar I disorder with the control group is that the mean level of creative cognition is not higher for the individuals with bipolar I disorder as compared to the control group. Furthermore, the mean level of lifetime creative accomplishments was not higher either. They did see increased variability with the bipolar I disorder group. And this is an important finding. So when we think of variability, we think of the distribution of scores. So there were more individuals with bipolar I disorder in the study who had lower lifetime levels of creativity and higher lifetime levels of creativity. So the scores weren't as grouped toward the middle as what we saw with the control group. This can explain some of the observations we see where individuals with bipolar I disorder are overrepresented among those who are famous. Another theory we hear sometimes with bipolar I disorder is that the medication used to treat bipolar I disorder lowers creativity. And this has been cited as a reason by some individuals with bipolar I disorder to not take medications. Now, that question was looked at here in the study as well, and the findings were that there were no effects on creativity from the medications that were used by the individuals in the bipolar I disorder group. So mood stabilizers and antidepressants did not seem to lower creativity. Another theory here is that the manic symptoms are associated with creativity. So maybe not specifically bipolar I disorder, but just the manic component. Well, that was tested here as well, and manic symptoms were not associated with creativity either. So does all this mean that individuals with bipolar I disorder are not more creative than individuals without the disorder? Well, that's what we see with these research findings, but it's important to note that even with the multiple measures, creativity is very hard to accurately assess. That's noted in this paper. There could still be creative components that haven't been explored because they're difficult to measure. So there may be a relationship, but in terms of the measures used in this study and the participants, no relationship was found. I hope you found this description of bipolar disorder and creativity to be interesting. Thanks for watching.